For Australians, mental health is a very important issue, yet is something that we don't talk about too much. So let's talk about it now. Let's talk about why it is important to you. Did you know 1 in 5 Australians experience a mental health condition? That seems pretty important, don't you think?
A significant number of Australians are impacted by a mental illness. As an Australian with a mental illness, you might not have a lot of information about your rights.
It is important to know that you have rights. But why should you be aware of your rights?
It's important to know your rights so that you know that you're not alone and so that you are able to access services and support structures to assist you to uphold your rights as an Australian with a mental illness.
It's important you know what to expect.
Being aware of your rights will assist you to understand what to expect from treatment and care and help you to be aware of what you're entitled to.
As a person with a mental illness, it is important to be aware of your responsibilities. Under the Australian Health Statement of Rights and Responsibilities, mental health consumers, their families, carers and support persons have the responsibility to respect the human worth and dignity of other people, respect their own health, safety and welfare, and respect the rights of others. Remember, mental health is just as important as physical health. Most importantly, know your rights. You have the same rights as everyone else. So what does this mean? You have the right to respect from others and of access to services that will assist you. You have the right to safety and the right to participate in your care. You have the right to clear and open communication and the right to privacy and confidentiality. And finally, you have the right to comment regarding your care. So let's have a look at respect. Under the Australian Mental Health Statement of Rights and Responsibilities, you have the right to be treated with respect. This means that your feelings, wishes and rights should always be taken into account by others. You have the right to freedom from unlawful discrimination, and your individual needs should be respected. This includes care that takes into consideration your sexual orientation, gender and gender identity. Next, we'll look at access. Access covers several areas. Firstly, you have the right to access mental health care. Mental health services are provided in Australia in a variety of ways. From hospital and hospital-based outpatient services to community mental health services. Housing and accommodation and financial support such as Centrelink. There are also general practitioners, psychiatrists and counsellors and consumer consultants. Consumer consultants are people with experience of mental illness who are able to offer support and advice. Your doctor or case manager can put you in touch with them. There are also support services such as the Personal Helpers and Mentor Service, which assists people over the age of 16 to manage their daily activities and live independently in the community if their ability to do so has been impacted because of a mental illness. Some other programs include the Medicare Benefits Schedule, which subsidises mental health services provided by psychiatrists and allied health professionals, including psychologists, mental health nurses, occupational therapists, social workers, and Aboriginal health workers. Remember, the right of access also entitles you to timely access to services, care that promotes your independence and recovery, and the choice of who is involved in your care, including not only health professionals, but your family and friends. Something important to remember is that you have the right of access to education and training, and the right to access employment suitable to you. You have the right to safety. You have the right to be safe when receiving treatment and care. This includes instances when a mental illness is severe enough to require involuntary admission and treatment. You have the right to high-quality treatment and care, the right to treatment in an environment that is appropriate to your needs, and to receive detailed information about your treatment. You have the right to participation. So what does this mean? It means you can live, work, and be involved in your community with equitable access to services you need, and be involved in decisions and choices regarding your care through all stages of care and recovery. Being involved also means that you have the right to refuse treatment. You also have the right to receive information in a form and language that you understand, and you can participate in mental health legal proceedings. Participation means you have the right to access advocacy and legal advice regarding your treatment, care, and social needs. And in the event of involuntary admission and treatment, participation gives you the right to use an advance agreement to direct your care.
An advance agreement is a template outlining your preferences for mental health treatment in the event that you are unable to say what you want when you're unwell. An advance agreement can look like this or this. Advance agreements explore treatment options. They provide a forum for you to uphold your rights of access and participation, and they give guidelines for your preferred treatment to your healthcare provider, your family, or your carers. Your advance agreement contains important information. It includes things like your responsibilities for children and family, your work and study commitments and arranging leave, money issues such as rent and bills, pets which need to be looked after, cultural and lifestyle preferences, triggers that cause you more stress, physical health problems and allergies, diet restrictions, and the medications that you might be taking. Finally, it's important to know that you can make changes to your advance agreement or you can withdraw it, and that they expire every 12 months, so it's important to review them.
Communication is another right. Although you might not think it, you have the right to be heard. The right to have a safe environment that supports information exchange between you and your healthcare providers. And the right to be informed about services, treatment, options, and cost. Also, the right to ask questions about your care and have them answered. You also have the right to communicate your views and preferences about your treatment and care options by using an advance agreement.
You also have the right to privacy. In Australia, you have the right to protect your own personal privacy and the right of privacy and confidentiality regarding the access and use of your personal information. You also have the right to access your health records in accordance with the law.
Finally, you have the right to comment. The right to comment on your care and have your concerns addressed. The right of access to complaints procedures. And the right of complaint if you are not satisfied with your service or treatment. All health services have complaints, policy and procedure. And if you are not satisfied, you can contact the Human Rights and Equal Opportunities Commission in your state or territory for advice.
The rights and responsibilities outlined in the Australian Statement of Rights and Responsibilities are for all Australians with a mental illness, regardless of severity. Respect. Access. Safety. Participation. Communication. Privacy. Comment.
So, as an Australian with a mental illness, it is very important to know your rights.